any day, anything that is even not just the skin and hair, any system, any organ of the body you talk about, your stress will impact it. Earlier, people were not aware about Botox, fillers, what anti-aging, what sagging, how to treat wrinkles, fine lines, how to get your plumper lips and all and everything, hooded eyes. So many things were there in the market, but nobody knew that how you can get these things treated. No matter what skin type do you have, you'll have to. अगर आपका acne prone skin है, तो आप नहीं remove कर रहे, then you'll end up getting acne. If you have a dry and sensitive skin, if you're not doing it, you'll end up getting pigmentation, blotchy pigmentation, or your aging will fast turn up.
हर सफलता के पीछे एक कहानी होती है, हर आवाज के पीछे एक अनुभव। टीवीटी वॉइस उन लोगों की बात करता है जो सोचते हैं अलग, करते हैं बड़ा और जीते हैं मकसद के साथ। यहाँ जुड़ते हैं एंटरप्रेन्योर्स, डॉक्टर्स, फाउंडर्स, लाइफ कोचेस, हेल्थ एक्सपर्ट्स और वो सभी जो दूसरों की जिंदगी में परिवर्तन लाना चाहते हैं। हम बात करते हैं ग्रोथ, माइंडसेट, पर्पस और इम्पैक्ट की, उन जर्नीज की जो इंस्पायर करते हैं और उन वॉइसेस की जो दुनिया को एक नया नजरिया देते हैं। टीवीटी वॉइस, जहां हर बात बनाए एक सोच, हर वॉइस एक प्रेरणा। टीवीटी वॉइस, द साउंड ऑफ चेंज। कॉन्टैक्ट अस ऑन 8448801064।
Hello everyone, welcome to another special episode of TVT. So today's episode is going to be very special because today we are here with a special guest who is a professional and a renowned dermatologist, cosmetologist and also an anti-aging expert. She also has a clinic named as Arcane Skin and Health Clinic based in Noida. So today's episode, let me tell you, is going to be very special because today we are going to discuss so many things about your skin care and your hair health. How can you maintain it? And nowadays we are seeing so many trends on Instagram as well. So today we are going to be debunking so many myths about your skin health. So watch it till the end and let's welcome our guest of honor, Dr. Radha. Hello, ma'am.
Hi, thank you, Niharika.
Yeah.
Thank you so much for having me.
Thanks for coming here, ma'am.
And letting me make people understand more about their skin and hair.
So, Dr. Radha, firstly, I would like to know about journey. Like, how did you get into this field of dermatology? So, what was your journey like?
So, dermatology has been quite time for me to, after finishing your MBBS, you just, land up in the world where you just want to explore which one is your specialization, what interests you. So somehow with a lot of confusions and all and everything, I choose to be a dermatologist because gynecology is not my thing. I thought, but that's something that I decided that I couldn't do rest of my life. So I picked up something which is more patient satisfying.
Exactly.
You connect with the patient more. And that's what I always like in the field of doctor. I like connecting with the patients. I like how they are once they're treated, their happiness, their joy, that always gives me a kind of sense of achievement that you putting something or you're giving it back, giving back to the society something that you have power to as a doctor. So when I started the dermatology, I finished my post-graduation, which is for like almost 3 years. After finishing my post-graduation, I realized that it is no more about just the dermatology. Dermatology has a overlapping happening with the cosmetology. Earlier, people were not aware about Botox, fillers, what anti-aging, what sagging, how to treat wrinkles, fine lines, how to get your plumper lips and all and everything, hooded eyes. So many things were there in the market, but nobody knew that how you can get these things treated. Those who have resources, they were going out of India to get these things treated. But eventually there was a shift which was happening. Dermatologists were getting more aware, they were getting more educations, more training regarding such things. So I have joined Kaya initially for 2.5, 3 years, which has given me a quite an exposure to understand that, this shift is actually happening in India and it is happening on a very fast scale. So that has given me a very nice experience, exposure to understand that it is not just about dermatology. आप सिर्फ skin infections, खुजली, hair fall, acne, pigmentation, melasma नहीं treat करेंगे. आपके पास एक और सेगमेंट है जिसको आपको इक्वली इम्पोर्टेंस देना पड़ेगा फॉर यू टू सस्टेन, राइट? बिकॉज if you're a doctor and you're just sticking to the old tradition and you're not evolving, as a person. You're not evolving in your profession, that you become stagnant.
Right.
So I had to evolve. I had to understanding a lot of conferences, going out, getting the trends, understanding the technology, which is very important in dermatology nowadays. Because you just cannot get any machine and start working on it. You need to understand how safe it is, what are the repercussions, kya results hai, how it is working, all of that. That's how you counsel your patient. If as a doctor, I am not aware that this machine works this and gives that sort of a result, I won't be able to deliver that confidence to my patient that, let's go for it. That it will give you that sort of, it will give you the results, that it will give you that sort of a thing that you are asking me to deliver. So all of that was quite a phase. Then I started my own clinic. Then I thought that a lot of people around me, a lot of my colleagues, and they were like, and all the kind of, ownership which is needed when you have your own place. You have that and you should start thinking about it. And then somehow, when God has his plan,
exactly,
he guide you.
Right. That's right.
So Arcane happened, which is my clinic, and I started that almost more than 6 years back and completed it.
Wow.
Yeah.
That's great.
So it has been quite a ride, and you enjoy. If you have your own place, it gives you some sense of accomplishment. You're working for yourself, actually.
Exactly.
And your patients, and you're more connected. Your patients are coming for you. They're more connecting to you.
Right.
The kind of satisfaction they get it once they're treated, once they feel good. चाहे आप acne treat कर रहे हो, चाहे आप कोई psoriasis treat कर रहे हो, कोई भी skin infection treat कर रहे हो, or you're just making a person slightly more confident about themselves by treating their looks here and there. There's no harm.
Right.
I think if something is bothering me for my looks and I can fix it without going through a lot,
Exactly.
why should I not?
Yeah.
Right? If
That's
that gives me a sense of confidence. If I have something which bothers me, I have a very huge scar. If it's there on my face, I have a birthmark which is there on my face that bothers me. Why should I not opt for lasers for the treatment? Right?
Yeah, exactly.
So all of that had given me quite a confidence to work for my profession. And when my patients are happy, that gives me a sense of satisfaction that, you are giving back something to the society.
Exactly.
I have, you studied as a doctor. You're not at least saving lives, but you're at least making people happy.
Right, exactly.
So yeah, that's there with my whole journey so far, with almost more than 12 years of experience in dermatology.
Exactly. But there's this one thing, Dr. Radha, that many people think that going to a dermatologist would be, much more expensive. So what do you think?
Depending, yes, definitely. There are the things, because earlier it was just about the medicines and prescriptions.
Yeah.
Right now, the medicines and the prescription are there, but the kind of lifestyle we are living is just the medicine is not working.
Right.
We need... पहले क्या होता था, your car, supposedly you're putting your car to a service, right?
Exactly.
Sometimes it's just not the servicing which is required. Sometimes additional work is also needed to be done.
That's right.
So is ours. So going to a dermatology clinic and getting the treatment, and it's exactly like that. I'm writing a prescription, I'm giving you medicine for your day-to-day skincare.
Yeah, exactly.
That will maintain your skin health, that will maintain your skin quality, that will protect you. But if it's something is there as a concern, which my medicine cannot treat, I will have to introduce treatment to it.
Right.
And that's where the price factor comes in the picture. That's where the people are saying, because we are introducing the treatment besides those prescription and the medicines.
Yeah.
So it is getting costly, but again depends how a dermatologist wants to approach.
Right.
It is a very, so if a patient is coming to me and the patient is actually in a need of having something to be treated, I will not put him across through a very extensive budget. I will try to minimize it, and I will try to work around with my patient's need and whatever he can accommodate according to his convenience or her convenience for that matter. And we work around that. Yeah. A good dermatologist should always do it. If not this, okay, you take this. It will not give you this much of results, but thoda aayega, and we'll gradually increase it.
Yeah.
Right?
Right.
So it is not expensive, but at the same time, it is demanding. It required some, and not always. Right? Some concern can be treated with medicines.
Exactly.
Magical treatments are there, which is medications are there. Nowadays, the market is flooded with the products, and some products are lovely for it to work on your skin and hair.
Yeah.
So not always. Not always it is hitting hard on your pocket.
Right. So, Dr. Radha, do you think that stress is somehow affecting our skin and hair health?
Any day.
Okay.
Any day, anything that is even not just the skin and hair.
Yeah.
Any system, any organ of the body you talk about, your stress will impact it. But why skin and hair in general? Because your stress level increases your hormones level. It fluctuates, it disturbs your hormones primarily. When your hormones are disturbed, it will give you many concerns. It will give you acne, it will give you hair fall, it will give you a condition called as melasma, which is very, very stubborn condition. Jhaiya bhi jisko hum bolte hain. So that condition is very, very stubborn for us to treat. And there is other conditions which in a segment of hair and skin which are affected and can aggravate by stress.
Exactly.
It is not just that. You talk about some medical conditions, autoimmune conditions, they are impacted by stress levels. You talk about hair. There is a condition when the psychological impact है stress का. Behavioral changes हैं stress की वजह से. Somebody start pulling their hair because of the stress and their hair start thinning. It's all due to stress. It's happening. Alopecia areata, which you have seen many people having those round bald patches on the scalp that we call as alopecia areata. That significantly contributed by stress. Your conditions like psoriasis, your lichen planus, urticaria, which you also called hives, ये सब conditions aggravate हो सकते हैं stress level से. So बहुत strong connection है stress का, both your hair and your skin. It shows directly on your face. You imagine if you were not slept well one night.
Right.
You're physically stressed, right? You're not slept, you're working and all and everything. And next day your skin is showing it right there.
Exactly. Yeah. Now I'm getting confused.
Yeah, your under eyes start reflecting it.
Yeah, exactly.
So your skin is a reflection. Your skin is the first place that it is reflecting that, your body is trying to tell you something.
Right.
You need to hear it out. I am knocking to tell you something. Understand. And that's what we go for investigations. We go for other, to find out, to rule out what's happening internally that is coming out. Basic acne का भी बहुत strong association है. Teenage peer pressures.
Yeah.
Right? They stress so much about their surroundings and to be up and out with the pressure of always looking great and the kind of social media pressure that nowadays teenagers have.
Exactly.
That sort of a stress gives rise to everything.
Right. That's right.
Any small to big, any skin concern, any hair concern has a strong association with it.
Yeah.
My prescription has a half counseling.
Okay.
Not even half. I think more than that is just the counseling part.
Yeah.
I take a consult every day. I have a few set questions to ask my patients that how's your diet, how's the lifestyle, कब से है, क्या है, and all of these just questions आप normally patients से पूछते हो. When I come to this one question is how's your stress level? I think 90% of the time my patients are high.
Okay.
I have a lot of stress going on. I have this, I have that. Whether it's a work pressure, whether it's a personal stress, everything counts.
Oh, wow. So what do you suggest? Like what kind of changes should we make in our lifestyle?
Yeah, that's very important. Basic to start with. Yeah, I do not like to put through anybody, you start making very extensive changes. Practically possible नहीं है क्योंकि उन changes को हमको as a lifestyle incorporate करना है.
Correct.
I always say कि आप वही changes करो जो आप lifelong कर सकते हो. You're not doing it. Supposedly, I have a lot of brides coming up, right? Because they have skin concerns or otherwise they just want to have a clear, healthier skin before the wedding. And I tell them, I was like, you are on this crash diet right now. You are taking care of your food and everything right now. and your skin is glowing, your results are reflecting. But make sure this is what you're doing it is not for a temporary period.
Yeah.
You should continue doing it for your skin and hair health. What I am putting inside my body is always a reflection in terms of food, right? Sugar plays a major role that we have heard. It breaks down your collagen. It does a lot of changes in your stress levels and all.
Yeah.
They fluctuate your hormones level, sugar. So we need to always in a controlled manner,
Right.
right? I never tell my patient until unless somebody has a chronic acne concern, जिनमें हम patients को हमेशा बोलते हैं कि आपको high glycemic index food को cut करना पड़ेगा.
Yeah.
आप उसको कंज्यूम नहीं कर सकते हैं, एक बहुत ज्यादा नहीं, कभी कभी वंस इन अ वाइल. उनके लिए तो ऐसा होता है दे शुड एटलीस्ट कंप्लीटली से नो, जिसमें आपका काफी हद तक डेयरी प्रोडक्ट आ जाता है, राइट? मिल्क प्रोडक्ट सारे उनको कट करने पड़ते हैं, उनको शुगर कट करना पड़ता है ताकि उनका एक्ने कंट्रोल में आए, बिकॉज वो हार्मोनल एक्ने है, वो पीसीओडी पीसीओएस की वजह से हो रहा है. सो फॉर इट वी नीड टू हैव अ स्ट्रॉन्ग कंट्रोल ऑन व्हाट वी आर कंज्यूमिंग. क्योंकि उसका प्रॉब्लम ये होता है कि कितना भी मेडिसिन मैंने चलाया, 2 महीना 2.5 महीना 3 महीने के लिए मेडिसिन दिया, एक्ने ठीक हो गया, आपने वो चेंजेस अपने लाइफस्टाइल से हटा दिए, राइट? एंड देन इट विल स्टार्ट कमिंग बैक योर एक्ने. क्योंकि आई एम हियर टू ट्रीट योर एग्जिस्टिंग कंडीशन, बट आपका रूट कॉज आपका डाइट है. You will have to treat your root cause. I am only a medium to treat your current situation. I can't treat your internal problems, and that's your lifestyle changes that your body is demanding.
Right.
So definitely we need to do workout.
Yeah. Exactly.
Right? Or for that matter, I tell all my patients, everybody who come in my contract, that any sort of activity. For that, it doesn't have to be you straight away going to gym. You just whatever activity you like, sports, dancing, running, anything that matters,
Right.
that you like, because we would want that good hormones to be released in the body for you to compensate for the stress which is producing your bad hormones.
Exactly. Yeah.
You need to give that sort of a time. So few pointers which are there. Supposedly you need to eat good, sleep, and your food.
Yeah. Got it. Okay.
In a proportion, मतलब controlled manner में once in a while I always tell everybody कि ठीक है, it's a life. You can consume things, but ऐसा नहीं है कि आप खा रहे हैं तो आप 10 दिन तक on stretch खा रहे हैं.
Right.
You can have one cheat day. You can have once a week skipping your gym.
Right.
Right? That's okay. That's doable. But not that I'm going once in 10 days.
Correct.
Right? So that's there. These are the changes which are actually environment is demanding nowadays, because the kind of sedentary lifestyle we are heading to, it is something that is so important for us to do it, for us to have that peaceful life.
Exactly. That's right. Also, Dr. Radha, personally, I would like to ask this question.
Yeah.
Like, what is your skincare routine? Because your skin looks great.
So, actually, honestly speaking,
Yeah.
doctors are the worst patients.
Okay.
That's a well-known saying, because what happens is now you just whole day the lifestyle like that is so busy.
Right.
You're busy at work. You're trying. So I try to stick what basic. And second is you need to treat your skin, or so skin routine has to be designed according to your skin type. आपका skin type आपको नहीं बख्शता, no matter you are a dermatologist also.
True.
So having acne, if you have acne prone skin, it's okay. आपके skin को नहीं पता है आप dermatologist हो, उसको आना है वो आएगा.
Yeah. Correct.
So I just know how to treat it. I just know how to fix it. Right. So with me, few things which are very important is, first thing is doing, which is basic day to day. That's important. आपको वो करना है. That's non-negotiable. Not skipping your sunscreen.
Yeah.
Yeah, I myself understood the importance of it after reading about it and become a dermatologist.
Right.
When I was in my college time, during my, I think, graduation, I wasn't even doing the sunscreen thing and all that regularly and religiously. But ever since we got we got to understand how important is sunscreen, it's one thing that you need to do. So आप basic बहुत important है. उसके बाद आपका life, आपका और आपका lifestyle आपको कितना allow करता है, accordingly you design your skincare routine.
Yeah.
Accordingly, you need to keep your food habits and your skincare routine intact. That's very important for you to. I still have it. If I eat sugar, I will get acne pop up. If I have it for a stretch for 1 or 2 days, if I'm out somewhere for a function and all and everything, and everybody gets some tempt.
Yeah.
So if I take it, I will get pop up, right? But I'll have to fix it. If I'm coming back home at night, I make sure I will have to wash my face.
Okay.
I can't sleep with that makeup on, with that product on my face, because I know that it'll block my pores and create an infection on my skin, on that pore, and land up in acne. So washing your face, doing a moisturizer, that's basic. So morning mein wash your face, do a moisturizer and your sunscreen. Besides it, if I have acne, I will do my medical treatment. So whatever the ointments and the product I want to put it, I'll put it before my sunscreen, my morning thing. Night again, I will wash my face. And then I do a very basic serum that my skincare allows, is an azelaic acid based serum. Because if I have acne prone skin, my skin does not allow me to put too many things all together. So just putting one serum, if at all you have time, if at all I am like too tired to do anything in terms of my skincare routine, I will just wash my face, do a moisturizer, or else wash my face, serum, bit of eye cream and moisturizer. That's it. Nobody needs 10 skincare. No one does it 10 steps. Nobody has time. Not even a doctor has it. My prescription doesn't have so many products for that matter. I write something which is practically possible my patients to do it.
Right.
I ask patients to have realistic expectations in terms of results. I tell them कि इतना ही ठीक होएगा, इससे ज़्यादा नहीं ठीक होगा. So they have the right expectations from me. So I also put up the right expectations that they can follow.
Exactly that.
Not giving 10 products in the prescription. I know it. He'll be like confusing every day. Which one to put? Not that. सुबह 2 या 3 कर लो, रात को maximum 2 या 3 कर लो, and that is you're sorted. Besides that, there's no end to it.
Right.
The market is flooded with the product. The market, you don't know what, every day there's a new product coming up. For how long you can just keep putting your products?
Exactly. That's right.
So just keep it simple, but consistent. That's my thing with the skincare.
Exactly. And also, Dr. Radha, being an oily skin girl, I would like to ask you this question. That, I've seen some reels and content on Instagram that niacinamide is good for oily skin. So what do you think about that?
See, when we talk about oily skin, we'll have to understand that not every product goes well with acne-prone skin. Like your niacinamide and your vitamin C also.
Okay.
Niacinamide is a very nice product. It gives nice glow and all and everything.
Yeah.
If you see a product, your skin start telling you that it is not suiting me.
Yeah.
Right? Pick up a product with the authentic company. That's important.
Okay.
Your percentage has to be important. If you're picking up niacinamide, I always tell my patient, pick one active at a time.
Okay.
Don't mix it with anything else. Maybe आपको niacinamide सूट कर रहा हो, but niacinamide के साथ जो उन्होंने additional active डाला है, वो आपके skin को ना सूट करे. Right? So if you have acne prone skin, if you have a sensitive skin and you think that you want to start a product, always start slow. Always start with single composition. Do not mix it. And start understanding your skin. You will start. Ideally, क्या होता है, when a product is not suiting me, it starts showing me with the eruption, the phenomena called as purging. Right? You understand, okay, this is not suiting me. Make a list of it and put it out of your shelf. आपको वो product नहीं सूट करता कभी नहीं. अब क्या होता है, एक बार मुझे नियासिनामाइड नहीं सूट किया, तो अगर वही नियासिनामाइड किसी और अट्रैक्टिव पैकेजिंग और बॉटल में आ गया, and some other influencer or Instagram person is telling me, I would again pick up. When my skin has already given me a sign that it is not suiting me, so next time अगर I'm applying it, my skin will react on a double strength. जो purging है वो और strongly आएगा, acne eruptions और strongly होंगे, right? So acne prone skin के लिए niacinamide works and azelaic acid. Two things works best. Even for that matter, you can apply salicylic acid also, but वो skin को dry करता है.
Right.
And it's good to have it if you have active acne और बहुत ज़्यादा extensive T-zone है. And winters में I anyways ask my patient to go easy on actives. Because your skin is dry, your actives might react. So
Right.
either you reduce the percentage or आप उनको gap कर दो. Right? Supposedly आप रोज लगा रहे हो, then do it alternate days. Whether it's salicylic, glycolic, retinol, anything. Right? So acne prone skin के साथ, it's when I write my patient, I always write with one composition, acylic acid, कि वो सबको suit करता है. Then if in morning I want to introduce, I will introduce niacinamide, but on a slow. जैसे initially twice a week start किया, just to see.
Right.
Then alternate days को किया, and then we put it कि चलो ठीक है, now let's put it every day. But otherwise, it's a very nice product. But just be careful.
Right.
Because dry skin जो होता है और जिनका oil dry normal skin होता है, उनके केस में काफी हद तक काफी प्रोडक्ट सूट करता है.
Yeah.
बट एक्ने प्रोन स्किन एंड जिनका स्किन थोड़ा सा रोजेशिया होता है, जिनको जो रेड कलर के पैचेस रहते हैं चीक्स पर और ब्रिज ऑफ द नोज पर, उनको हर प्रोडक्ट सूट नहीं करता.
Okay, got it.
So your can be more of a azelaic acid and salicylic acid, and moisturizer is very important. Pick a moisturizer which is more on the gel based side,
Yeah.
and the sunscreen also. Nothing too greasy on the face if you have acne prone skin.
Yeah, got it. So also if we speak about hair fall, so what do you think कि अभी मतलब कम एज से भी hair fall जो हमारा start हो जाता है, उसका major reason क्या है?
Again, we have discussed the kind of stress that we are
Yeah.
taking nowadays, right? You go to college, how the world is changing. When we were in a college, we used to be very carefree.
Yeah.
We hardly had any stress about how my hair is looking, how many Instagram followers I have, how many times in a week I'm partying, pictures posting,
Yeah.
right? How much were we conscious about our looks? Hardly, right?
True.
So, and how much of the product we were using, right? When we were in a college, we were hardly allowed to color our hair. We were hardly allowed to do those straight, what do you call it? Straightening, rebonding, and hair botox. The other thing has come. They all have chemicals, right? Nowadays, you meet a teenager. She's getting all of this thing. She has a colored hair, right? She's blow drying her hair every day. She's straightening her hair every day. So if you're putting your hair every day through these kind of heat tools, they're damaging.
Correct.
The moment you get rebonding done, hair coloring done, they're damaging the hair bond, sulfur bond we have in here. They damages those bonds, and then eventually leading to those frizzy, dry, weak, brittle hairs.
Right.
These are the things we need to be careful what we're putting on our hair. Again, at the same time, in all condition, dandruff ho gaya, that leads to hair. Aapka dandruff bhi, how you're cleaning your scalp, all of this is related when you're staying out and all, and your nutrition.
Okay.
That's very important. Nowadays, those all young adults and all and everything, they are more into, maintaining themselves. It's a good thing, right? But make sure you're eating a good nutrition diet.
Right.
Make sure vitamin D, B12, your hemoglobin are normal. You're consuming good diet, which is biotin, proteins, all of it.
Right.
So that needs to be taken care of. Not just that, because itna zyada lifestyle changes ho rahe hain with the adults, everything is coming in together.
Exactly.
So nowadays we are observing it at the age of, we see, I think I have a patient coming up after the age of 20, 21 nowadays for hair fall.
Oh.
Yeah. Even I have girls coming up, boys coming up around 16, 17. I tell them, eat food, eat good, stress less.
Right.
Before 20, 21, I thought even don't start any medications. So 21, 22, I tell them, no, you fix yourself. Because even if I give medication, that's temporarily. And जितना भी hair fall का medications होते हैं, उसमें से अगर ऐसा कोई phase नहीं है जिसमें it's something which is causing it due to any illness, कोई acquired, कोई बाहर से कोई problem आपके hair fall को affect कर रही है, then I will start the treatment. But at this age, अगर आपका genetic involvement नहीं है, अगर आपका nutritional factor है, अगर आपका lifestyle problem है, then I need to first fix that.
Right.
And then see, then आप मेरे पास आइए 2-3 years के बाद. Then I will see if it's still happening, then I will start treating.
Yeah.
But at one shot, at the age of 16, 17, not until other conditions जैसे I have discussed
Yeah.
कि autoimmune condition, alopecia areata है,
Right.
कोई scalp infection है, fungal है, bacterial है, जिसकी वजह से hair fall हो रहा है, that we will be treating.
Yeah, exactly.
But not you coloring your hair every day, you're putting your hair through so much, and you don't want to stop doing it, and then expecting us to treat it. That's not possible.
Exactly. That's right. So now, Dr. Radha, I would like to ask you कि सबसे ज़्यादा common हम skin care mistakes क्या करते हैं अपनी daily life में?
Okay, the one and the biggest is
Yeah.
seeing everything on social media, order it, click, start putting it on your face. So this actually the problem is there's too much of information available nowadays. I think as a patient, as a person, if I would not have been a dermatologist, then definitely I would have also been in the same situation.
Right.
You won't believe I have a patient coming up to me, bringing this whole lot of serums and all, 10 to 15 bottles.
Yeah.
And they come up to me and then they're like, Doc, I've tried this, this, all of it, but nothing is working.
Okay.
And I tell them because nothing is working means you're trying too many things.
Right.
Right?
Yeah.
And there is everything. Some ingredient are there, and sometimes they bring the ingredient which, as a dermatologist, I am not aware.
Okay.
Some fancy, because nowadays what happened, people don't understand that. I agree that we are following the trends, and it is a good thing. But we need to understand that what's suiting the Korean skin will not suit Indian skin.
Right.
This Korean beauty trend, Korean products and all and everything, if I don't want to name the brands, but they are very popular. And their genetic alignment, their skin type, their environment is way more different than us.
Right.
Right? We have a skin which is way more complicated to deal. You cannot put those Korean and those Japanese and what's so on product right there available in the market. So that's one problem. That we are putting too many things. We're thinking, oh my God, I'll put 10 things, I'll get quick result. There's some magic will happen. No. There is no magic in the skin industry.
Yeah.
You need to stick to less is more. Right? Get the right alignment. Somebody who has just been paid to promote a product is not for everybody.
True.
I am not denying that the product might not be good, but definitely that product is not for everybody.
Exactly.
Right? If the salicylic acid is good, that salicylic acid is not for the drying skin.
Right.
If the ceramides are good, that ceramides are not for acne-prone skin. Right? So, and what everybody, you talk about celebrities for that matter, we get so influenced that, oh, I'll get a skin like her, I get skin like him. No, those are all filtered. Those are all makeup.
Yeah.
Right?
Exactly.
Everybody has flaws underneath. Everybody has concern underneath. So one thing is understand your skin and do not pick anything and start putting it.
Exactly.
Second is over exfoliation. Right? I asked my patient, which face wash do you use? I use a scrub-based face wash every day. No, you don't.
Yeah.
Right? By that, you're ripping off the protective layer of your skin, natural moisture of your skin. And that will make your skin go sensitive. Right? So exfoliation is important, but not over exfoliation. Besides this, there are very common things, very basic mistakes that we do in a day-to-day mistake is not removing our makeup while sleeping at night.
Right.
No matter what skin type do you have, you'll have to. अगर आपका acne-prone skin है, तो आप नहीं remove कर रहे, then you'll end up getting acne.
Right.
If you have a dry and sensitive skin, if you're not doing it, you'll end up getting pigmentation, blotchy pigmentation, or your aging will turn up. Second is if your makeup brushes, your makeup tools that you're not cleaning it. But most of us do makeup almost every other day nowadays, right?
Yeah.
You're just done the makeup and you kept your brush like that and you're not cleaning it. All the bacteria which have been collected, you're putting that back on your face.
Yeah.
So clean your tools. It's important. treat your acne.
Yeah.
If I am not treating, पहले बहुत स्ट्रॉन्ग मिथ था कि नहीं ये तो एज के साथ आए हैं, एज के साथ चले जाएंगे,
Right.
कुछ
Yeah,
करने
my
का
mother said that,
जरूरत
yeah.
yeah, exactly. We all of us have grown up with that sort of mindset.
Right.
But no, वो तो चले जाएंगे, बट वो पीछे जो स्कार्स और पिगमेंटेशन छोड़ के जाएंगे उसको कौन ट्रीट करेगा? And that's more difficult to treat as a dermatologist, I'm telling you. So if you treat your acne right, it will not leave that scar.
Right.
That is permanent.
Exactly.
And so important है, आपका कोई स्किन इश्यूज है, टीन एज में एक्ने हो रहे हैं, अर्ली एज में एक्ने हो रहे हैं, you get it treated the right way. And you keep your skincare simple. Right? Doing too much as we discuss, makeup भी है, बहुत सारी चीजें हैं. स्किन केयर रूटीन को सिंपल रखिए, पिक अप योर राइट स्किन टाइप, टॉक टू योर डॉक्टर अबाउट इट. पहले एक मिथ होता था, you just put a toothpaste on the acne,
Yeah.
to dry it up.
Exactly.
There are so many things which are there. You do not, if you're using your phone, it has a bacteria collection over it also. Just
Exactly.
wipe your phone whenever you have time. Change your pillow covers and all and everything. All of these basic things, if you do, these are the basic mistake day-to-day lives maybe are doing it
Right.
in our skincare routine. So, and you'll realize, I see more often in my practice that patient has acne one side more than the other side.
Exactly. Yeah.
Right?
Yeah.
Why that happen? Because the way you and I are keeping our hair.
Right.
Right. So that is also, whatever the product, whether the serum, whatever the conditioner, whatever dust my hair has,
Yeah.
it is right here under constant contact with it. And phone, अभी एक phone आएगा, I'll pick it and put it on my
Yeah.
right. अभी उस duration में उस phone पे जितना dust हुआ, I have picked it and put it on my.
Right.
If I'm talking over a phone for more than 15-20 minutes, my phone heat up, right? अब वो heat भी उस acne पर आ रहा है.
Exactly.
So all of that aggravate. I tell कि नहीं, आप फिर इसमें मैं advise करती हूँ, somebody who has a long working hours and their work doesn't allow, they have to be on phone because of their, then you put your headphones,
Right.
right? Do these basic changes.
Got it.
Not all the घर का नुस्खाs are good,
Exactly.
right? You can't put nimbu directly put on your face.
Right.
it has a ascorbic acid, उसमें acid है, वो burn कर सकता है. जो market में vitamin C मिल रहा है, वो vitamin C purified form है, उसको stabilize किया गया है out of lot of experiments and the researches. इस percentage पर, इस molecule को उसको derive किया है. What you're putting from a lime is a direct ascorbic acid.
Yeah. Exactly.
It can burn your skin. So these are the few things which I have seen day-to-day life that people are getting reactions a lot nowadays.
Yeah.
बहुत ज़्यादा allergies आने लगी हैं, skin sensitive होने लगी है.
Right.
It's just that we start without understanding. So first understand your skin and then start.
Yeah. Exactly. So, Dr. Radha, do you think that those salon facial treatments are safe for us, safe for our skin?
See, if I talk about safety, because primarily आप किस concern के लिए वो facial ले रहे हैं,
Right.
वो matter करता है. अगर मेरे facial का motive सिर्फ relax करना है, I'm going for the only purpose कि I want a good massage, then you very well go to a salon. As a dermatologist, I have.
Okay.
But अगर मैं facial जा रही हूँ लेने के लिए, something which should give me some result to my acne, जो मेरे को अगर oily और acne पर prone skin है, तो मेरे को अगले दिन acne ना दे दे.
Right.
Right? मेरे को थोड़ी brightness long lasting रहे. Something should not turn out to be sensitive. Next day मुझे redness या irritation ना हो जाए. Right? Then I should be careful. Then I should pick a dermatologist because there you have a doctor who will examine your skin thoroughly. अगर मुझे लगता है कि right now supposedly you are there and I'm going for taking you in my clinic for a facial, I will completely opt out anything which is more greasier side as a product.
Okay.
I will not give you a facial that has extensive massage to it, no matter how much you say.
Yeah.
I'll can just do the head massage without the oil that you get it done. But will I put that product on your face? No, I'll completely deny that. My facials would be designed, medical facials are designed according to the skin type. The product which are incorporated are medicated product.
Yeah.
So my product then designed according to the skin type to treat a concern. कि अगर supposedly acne है भी, तो वो थोड़ा बेटर हो जाए कल. अगर पिगमेंटेशन है तो उसमें वही एक्टिव्स, वही इंग्रेडिएंट्स हम पिक करेंगे जो स्किन को ब्राइटन एंड लाइटन करें. And when you're picking up the medicated product, the advantage is the results are long lasting. अब ये भी नहीं चाहोगे ना कि आप 5-6 हज़ार रुपए सैलून में फेशियल में देकर आ रहे हो एंड 2 दिन बाद you feel like same, like nothing happened. You would want at least कुछ 20-25 days तक तो मेरा face रहे normal.
That's right.
And with the medifacials and the dermatologist based facial, the advantage is कि results keep building up.
Okay.
You are improving your skin health with time. The equipments, the machines that we use, बहुत सारे, supposedly we have HydraFacial, MD. That's, again, I'm telling you why it is important to a girl go to a dermatologist. Emphasizing the authenticity of a machine. In my clinic, I have a machine which is original HydraFacial. That is HydraFacial MD.
Okay.
अब अगर आप Google करो HydraFacial, दुनिया लेकर बैठी हुई है. Right? So, but are they using the original HydraFacial? No. Right? So, those machines are USFDA approved. The machines are authentic. That's why the results are long lasting and gives you a very nice skin health and the results.
Okay.
So that's the primary difference. That you just need to pick your thing. What's your intentions and what's your motive before going for a facial?
Yeah, exactly.
Yeah.
So also, Dr. Radha, earlier we were discussing about skin types, right? So how can we identify it? Yeah, most importantly.
Very easy, very basic, I will tell you. Let's see, we have oily skin, we have combination, we have dry, and one category sensitive. अब क्या हो सकता है, सेंसिटिव स्किन इन तीनों में से कोई भी हो सकता है. अगर मेरा स्किन ऑयली है उसके साथ सेंसिटिव भी हो सकता है, ड्राई है तो उसके साथ सेंसिटिव भी हो सकता है. चांसेस इट ऑफ हैविंग सेंसिटिव विद ड्राई स्किन इज मोर. इफ आई हैव अ ड्राई एंड स्किन, चांसेस है वो ज्यादा सेंसिटिव होगा देन द ऑयली एंड द एक्ने प्रोन स्किन.
राइट.
If there's one funda that everybody can follow. Face wash करिए, ठीक है. Wait for half an hour. Don't put anything.
Okay.
ठीक है. Take a tissue, normal. Put it on those T-zone of your face. Right. If you see that your tissue is getting some moisture, and maximum you can stretch for 2 hours. This thing to just check. Lastly, if you see that you have developed moisture in just half an hour or 45 minutes of time on your T-zone, that you have a combinational skin.
Okay. Yeah.
If you have the oil coming up almost entire face in half an hour, 45 minutes of time, then you have oily skin. If you have no oil build up in 1.5-2 hours, then you have a dry skin.
Okay.
Right?
Got it.
Sensitive skin is something which you need to see. If you have a red, flaky skin, then you have a sensitive skin. You have constant redness around this. We have two sensitive areas. Mostly if you'll see sensitive, these cheeks are the one which shows the sensitivity in the highest पूरे face पर, right?
Exactly.
And the dryness feels around the chin area the most. So if you are applying any product and you feeling that मुझे irritation हो रहा है मेरे cheeks area पर and this around the lip area and the irritation and it's pretty high, it's burning, immediately get off with that product.
Okay. Got it.
Because these are the two areas where you will feel the sensitivity a little high. So that's how you can find, and you can pick your products according to your skin type. That's very important. And treating it again, very basic. Follow this one funda. Agar mera acne prone skin hai, my product will be light in texture. Oily skin hai, I will have to go for everything, whether it's my sunscreen, moisturizer. I will have to use something which is more on the gel base, more on the watery side. No greasiness, no oiliness should be there in my product. Also in my cosmetics.
Yeah, right.
People do this mistake more often that उन्होंने products तो सारा oily and acne prone skin का चल रहा है, but cosmetics में foundation में भर के oil है.
Right.
And they use it every day. So my purpose is not solved. I will have to pick my cosmetics because आजकल cosmetics में भी बहुत advancements हो रहे हैं.
Right.
The cosmetics also coming as a oil free.
Yeah.
Right, light moisture. Even the primer comes separately for a oily and acne prone skin or for a normal to dry skin. Foundation, everything is coming according to skin type. So please pick your cosmetics also according to your skin type, not just your skincare.
Right. Exactly.
Yeah.
And also, Dr. Radha, recently I've seen this reel on Instagram, and it says that if we apply makeup on our skin, so it creates a barrier, a layer on our skin that protects our skin. So is this correct?
So anything which is covering your face, it is creating. But you always need to understand, there's one thing which you doctors always have it, ki risk versus benefit ratio होता है.
Okay.
Yeah. अभी जितना मुझे benefit नहीं होगा उससे ज़्यादा I'm taking a risk by putting those harmful chemical which are there in the cosmetics. So rather than, if my intention is just to protect my skin, why should I not choose sunscreen to do that for me, right?
Right.
So I should not एक चीज ठीक करने के लिए आप दूसरा चीज तो नहीं, you cannot bring on something which is harmful.
Exactly.
So if makeup is not your essential part of your lifestyle, then I think you should avoid. Stick to your basic. आजकल तो sunscreen में भी इतना हो गया है that tinted sunscreen has coming up in the market. So those tinted sunscreen has additional protection and they give that coverage that most of the people want.
Right. Exactly.
So why, if अगर मुझे वो barrier ही create करना है, I would prefer to do it with my moisturizer, with my sunscreen. On top of it, if needed, I'll put tinted sunscreen as a layer. And that's about it. क्योंकि I nowadays spray sunscreens भी आ गए. अगर वो ही protect कर रहे होते, then why there is a spray which we say ki put it on top of your makeup also.
Yeah, exactly.
Right? So only thing, if my intention is to protect my skin, my primarily thing is using a right antioxidant, which is also protect vitamin C serum. That works as a very nice protecting antioxidant agent. And do your sunscreen. ये best चीज़ है अगर आपको अपना skin protect करना है तो.
Okay, got it. So, Dr. Radha, do you think that men should equally care for their skins as well?
Yeah, and for my surprise, awareness is increasing a lot nowadays. But at the same time, why should they not?
Yeah.
They also eat, breathe, live in the same environment as we. But honestly, yes, we tend to fall for these things as a female because earlier the trend was skincare is a part of girl industry. It is more of a female thing, right? If you're doing this cleansing, moisturizing and sunscreen, it is more like a girl's, part and all and everything. That trend is shifting. Nowadays, the men is also feeling that no, it has no gender skincare. We need to put it beside ki, this is for the female, this is for men. Skincare is for everybody because here we are just talking about basic that your skin need before it's too late.
Exactly.
I have most of the men coming up to me with the pigmentation concern, acne concern, extreme of scarring when it's too late for them.
Yeah.
Right? And again with the kind of, and for that matter, they need it more than a female because they are more exposed to the outside world than us.
Correct.
Right? Females now we are exposed, we started going out and all and everything, but men were always been out.
Yeah.
Right? So their skin is more damaged
exactly
than ours. And they need more care, protection, treatment, all of it more than a female. But it is shifting for sure. And they need it too.
Exactly.
And because skincare, something pigmentation ho, chahe acne ho, wo kisi ke face pe nahi acha lagta.
Right.
If you want to own up, that's your thing. But if you don't like it, I don't like it. Say, let me get. Nowadays, the awareness about anti-aging is also getting very high in males also. Everybody wants to look good, look young.
Exactly.
So it's for both.
Yeah, right.
Simple skincare is for everybody.
Yeah, exactly. So should they follow the same routine?
Absolutely.
Okay.
And one thing which most of us does, and especially I've seen more in the cases of male, ki I like what you put. I put Johnson baby moisturizer or the shampoo or that. I was like, why? I think because it's more, it's for the baby, so it has less chemicals and all and everything. Then I have to guide them right. It's for babies. It's for the skin that is not exposed to anything. Adult cannot use baby products.
Okay. Yeah.
You need to have, by thinking that these products are have less chemicals and less that, no, you will not get any result. I think the normal face wash also might not be cleansing their face that properly, which is needed. So men or women, they both can have same skincare routine according to their skin type. There's no discrimination. There is some ad come ki for males there's a charcoal face wash. There is this now just do a simple
Yeah. Exactly.
and on top of it, my prescription for male versus female,
Yeah.
I think it's half.
Okay.
When I write product for a male patient, it's hardly have any product. And he's like, doc, you don't want to write any serums and all. मैंने कहा, "फिर first for me, do this basic. तुम face wash, moisturizer, sunscreens कर लो for me
Yeah.
for 3 months. And if you do it right, then I'll go for enhanced. Because I know you have not done this much till now.
Right.
So that's important.
Yeah.
And that's what everybody should do.
Exactly. So lastly, Dr. Radha, I would like to ask, like, if you could give any one piece of advice to our audience, so what would it be?
I think one advice that I would like to give, and which is very important nowadays, is everybody is becoming a dermatologist. Everybody is becoming a skincare expert.
Exactly.
The internet, the social media is full of such things.
True.
So I think as an audience, we need to increase our awareness. Whatever you are seeing, whatever, even for that matter, people have started injecting, those who are not certified to inject.
Right.
Right? I have been injecting Botox fillers and doing all of that for years, 12, 13 years now. And I see people who are not certified to do it, they are doing it.
Yeah.
If, God forbid, there are a lot of repercussions. You need to understand the anatomy. You need to understand what product, which product, where you need to put it for the better results, the safety of that product, where you're putting it, it's your skin.
Yeah.
So get it done with the right person. That's very important.
Exactly.
Basic skincare bhi hai. Even for that matter, such treatments. We have a lot of myths about anti-aging. We have a lot of myths about laser hair reduction and the skincare treatment, that it's not safe. Botox se ye hota hai, filler se ye hota hai, that celebrity has died, with this celebrity has died. All of that happened. But all of these are myth. Talk to the right person about the particular thing. You need to talk to a specialist. If you're talking about skin, if you're talking about cosmetology, talk to a dermatologist.
Exactly.
And get the right piece of information, because half information is dangerous.
Yeah, true.
Yeah, so that's all from my side. And I think get to know more about it. Instagrams is full of information.
Yeah.
Full of information.
Exactly.
Thank you so much for watching this podcast. And if you have any skin or hair issues and you want to connect with me for any of your concern related to skin, hair, anti-aging, laser, and so on, connect me on the details given below on the screen. Thank you.